Okay, well, perhaps we can get started. Good morning, everybody, and it's a great honor and pleasure to welcome you to the first McGill Department of Surgery Women in Surgery Grand Rounds. This initiative, Women in Surgery, was started by Leanne, as many other good things in our department, with really the goal of creating a community where we can share camaraderie, mentorship, experience, and explore challenges and creating opportunities for each other. And it's really an open conversation, this initiative. We want it to become what it needs to become and what we want it to become as a group here at McGill. And with the goal of keeping professional development and mentorship and sponsorship in mind so that we can grow within McGill and our faculty, our trainees, everyone can grow within McGill and in the global surgical and academic community at large. So it couldn't be more fitting for me to welcome a role model, a friend to the surgical community, Dr. Stein, to really initiate this series. Dr. Stein is a colorectal surgeon at the University Hospitals in Cleveland and a professor of surgery at Case Western. And she's the past president of the Association of Women Surgeons. She has served as the chair of the American College of Surgeons Women in Surgery Committee. She served on the Executive Council for the American Society of Colon and Rectal Surgeons, and she was the recent program chair of our annual meeting at the ASCRS, which was an awesome meeting. She is also the director of their surgical research outcomes center, which is called UH Rises. I loved it, Research and Surgical Outcomes and Effectiveness Center. And she's the program director of colorectal surgery. I don't know how she does all these things. But she's also received accolades for her clinical work, the Murdough Master Clinician in Colorectal Surgery, for her outstanding contributions to her patients and her hospital. She's published over 100 articles and, in colorectal surgery, minimally invasive surgery, which she's very well known for, but also about the salary gap in surgery, starting salaries for colorectal surgeons, and pregnancy leave internationally. Dr. Stein was actually the first woman to receive the honorary fellowship from the Association of Surgeons of Great Britain and Ireland. And above and beyond all her superlative accolades, she's a mom, a wife, and she has a super real and energetic, positive and engaging personality. I haven't had the chance to hang out with Sharon too much, but from afar, I can feel it. And I'm really excited to get to know you better, to learn from you this morning. And I'd like you to all join me in welcoming Dr. Stein. Thank you very much for joining us.
Well, thank you so much for that really nice, kind introduction. I do a lot of juggling, I suppose. Can you guys see my screen now? I want to make sure.
Yes.
Thank you so much. So it's an honor to be here today. I'm really excited. And I was just saying to Marlies that I haven't been to Montreal, I think, since I was a kid. So I'm a little disappointed it's over Zoom, but I will hopefully come up and visit you guys at some point, whether that's officially or unofficially, to come. And actually the food in Cleveland, not as good as I expected it to be for the Grand Rounds in Montreal. I'm going to talk to you today about creating surgical leaders. And I want to kind of just pose that and tell you why I chose that. And, what I do before I go to Grand Rounds is I often just kind of do a little research, and I look online and I look at your website and everything. And I was really impressed that when you go to the McGill Department of Surgery website, the first thing you see is Our Words Matter. And there were a couple things that I really struck me about that. One is the intentionality, right? That if we're intentional with what we do, we can make a difference. And I think that makes such a huge difference, particularly when we're talking about changing inequities. And I think, as the inaugural Women in Surgery Grand Round speaker, I think we are talking about changing inequities. And I think our words matter in so many different ways, but being intentional. And then the other thing that strikes me about those is that there's going to be some sort of needing to actually respond to that. That if you say words and you say the wrong words, there's going to be some sort of fixing of that, right? That we actually will make sure that we continue to do things better. The other thing I want to say about creating surgical leaders is that we often see ourselves differently than other people. And I think if we're trying to change inequities, we need to take a good look in the mirror and see what everybody else sees and spend some time doing that. And I think when we talk about training surgical leaders, it's about becoming more intentional and knowing ourselves better and knowing how others see us better. And in that way, hopefully we can help take care of some of those inequities. I want to give you a couple disclosures. And the first disclosure is that I actually have kind of a part-time gig where I'm actually doing leadership development and coaching on the side because I didn't have enough balls in the air. So I needed a couple more to put in there. And this is nothing, there's nothing about that here, but this is what my passion is. And I'm actually doing outside of academia as well as inside academia at this point. And then my husband does have some relationships with Bristol Myers Squibb and Smith Medical, none of which are really relevant to that. For it. And this is the part, a couple of virtual requests for you. The part I told you, first of all, if you're not driving and you're not in the middle of like coding a patient or doing something along those lines, if you can put your camera on, I love to see faces when I talk. It's really kind of responding to this black box. And it's super helpful for me if you have your cameras on that I can see you've either fallen asleep, I've lost you completely, or you're actually excited about what I have to say. The other thing I'm going to ask you is a little bit of an unusual request. If you can have your phone ready, there's one part of the talk where I'm going to actually make it a little bit more interactive, trying to keep you awake maybe, or create this as a more interactive experience where I'm going to ask you to actually participate with me in a little bit. And then if you have questions or comments, I'm happy to make this more of a discussion, and hopefully we'll have some time at the end for some conversation. But please put questions or comments in the chat. And if you don't have the opportunity or you want to continue in some sort of conversation about it, because that what I said was interesting enough to do that, please feel free to email me or to tweet at me. Either way is just fine with me. So let's talk about creating surgical leaders. And I think that this is such a powerful thing to do for women in surgery. I think it's powerful for everybody. And I think when we think about creating surgical leaders, we should think about creating all different types of surgical leaders, as you will see. So I want to go through a little bit about how I describe leadership. I want to talk a lot about leadership styles and why leaders need to understand themselves, how leaders work with one another, and how they need to have a vision. And finally, I'm going to talk a little bit from a training perspective, why we should be training leaders, why we should make this part of our curriculum as important as learning how to do surgery. So first of all, there's this whole nature versus nurture. And my daughter, who is 11, loves this show, Boss Baby. I don't know if you guys watch that at all, but it's about this baby who was basically born to be a boss. And as a baby, he goes around talking and he has his pacifier and everything, and he's born as a boss. And some of us were probably born as leaders, at least born to be in front of people, to enjoy that and get our energy from that. And some of us have different leadership styles, as you will see, where maybe we didn't come out that way. But what I want to show you is that whether or not you were born, quote unquote, to be a leader, your leadership style is just as important and super essential to making us whole and to making us as a profession whole and to making, whatever you participate in. And there's not just one leadership style. We don't all need to be the same. I also want to say that in surgery, it's really common. We have this whole, saying, see one, do one, teach one. It's interesting. We've actually gotten away from that. And we realize that we need to be more intentional, going back to that word, more intentional on how we teach surgery. Well, we also need to be intentional about how we train ourselves to do the things around surgery, to be leaders, to be people who can actually see who they are, respond to other people in appropriate ways, communicate better. And we've spent a lot of time now and a lot of emphasis on changing the way we educate about surgical tasks. And we've spent very little time. I know Dr. Boutros is over at a leadership development program for the fellows right now, but we spend a day out of the year or 2 days out of the year talking about how to develop ourselves as leaders. And we are all leaders. I will tell you that. If you work in surgery, you're going to be a leader. The traditional triple threat, the academic, clinical, and educational person, there are lots of different ways. This is not the same as it was years ago, right? And the way that we actually rise in surgery these days is actually a little bit different. And what we actually know is that there are zillions of places where we need leaders. We don't just need leaders in microbiology. We don't just need leaders in the clinics. We need leaders in all of these different places. As a surgeon, you will be if you do nothing else in leadership, quote unquote, you will be leading your team in the operating room. But there are all these different ways that we can be leaders. We have leaders in technology, leaders in new techniques. We have leaders in surgical outcomes. We have leaders in education. We have leaders in making sure our interactions with our patients are better. And there are so many different ways to lead that why would we expect that there would be at some point a single leadership style or a single way to be a leader? And there are many, many ways that we can be a leader and many ways that we can show where we are. So what we want to do is figure out what is the shadow that we as individuals are really casting. How are we affecting the people around us? And how maybe can we change the way that we affect others around us in order to be more influential? So one, we are all leaders. We're leaders of patients. We're leaders of our team. Some of us will have actual leadership positions, and we'll talk a little bit about this. But we all have the potential to be significant leaders. So let's talk a little bit about a definition of leadership. And I've gone through a lot of different things, and I actually really like this definition. Leadership has nothing to do with your position, title, or seniority. It isn't management. And management is about, I like this definition as well. Management is about doing a task. Leadership is about what task to do. And if you think about the difference between those two things, you'll think about the difference between really making those decisions and doing the actual pieces of it. And it isn't at all dependent on your personality or the personality of others. So this is the definition, that leadership is the process of using social influence to maximize the efforts of others towards the achievement of vision. And this has actually come from you can see LeadX, Great Leaders Have No Rules, Kevin Kruse. But what I actually think is interesting is there are multiple pieces where different leaders emphasize within this definition that actually are important for leadership. So one is process. There are people who are really good at getting tasks done, at doing things, and that's one part of it. Social influence, that's the piece that comes most naturally to some people. Maximizing the efforts, actually getting the most out of people, sometimes that's the piece, and sometimes it's the piece of the vision. So I want to go through these 4 different areas and look at different leadership personality styles to talk about how different leaders actually show up. So the people who come up with process are often called experts, right? Someone who, you think about Nobel Prize winners, right? They are very much about an expertise in a single area. Social influence, these are people who are influences, people who just kind of tend to be the Pied Pipers of the world, who tend to have people follow them along and kind of lead in that way. Maximizing the efforts of others is really about an external, humble leadership. And lastly, vision is what we call a visionary leader. Leadership personality styles, all of these people, you can think about them, they're all leaders, right? All these people have led in their own way, in their own communities, in their own places and everything. And all of these people have one of those 4 different leadership styles. So if we look at this, we can kind of break them into 4 different groups of how people are and how people lead and kind of think about them. The visionaries are up in the upper left. The influencers are on the upper right, humble and expert. So let's walk through each one of these, starting with our visionary leaders. The visionary leader, these are some quotes from visionary leaders. Leadership is for those who take it. Leadership is about solving problems. If you quit once, it becomes a habit. Never quit. What are the positive attributes of people who lead in this type of way? Well, they tend to be risk takers. They're out of the box thinkers and they're great in the crisis. If you are literally drowning on a ship, somebody who can think outside the box and get a new idea and take that somewhere is someone you might want to be your leader there. Every leadership style has its positives And every leadership style has its negatives. The negatives for this leadership style is that they tend to be dominant. Sometimes they walk right over other people, and they actually don't give people the chance to actually contribute the pieces that might be really important. They can be abrasive. Sometimes they just anger people and frustrate people, and they can be intimidating. This isn't the warm and fuzzy leader that you necessarily want to go to and spill your guts. And even if they might have great ideas, you might not be inclined to go up to this leader and tell them what is most important to you or your ideas. Very intimidating in lots of places. What about our influencers? Our influencers, here are some quotes. Energy begets energy. Don't make money your goal. Instead, pursue the things that you love doing, and then do them so well that people can't take their eyes off of you. What I like about that too is it's about themselves. It kind of brings it back. They are about creating almost a cult of themselves, right? They're very people-oriented. They're very positive. They're very motivational. They are literally the Pied Pipers. They are the people who bring people around, that make people do things that they might not expect to do and everything. But oftentimes they can be careless with details. These are people who think big picture and think about things, but they might not have the nitty-gritty there. They often also overpromise. They kind of believe that they have the ability to do anything. And sometimes they're able to deliver on that, but not always are they able to deliver on that. Our next leadership style is our humble leader, and I think that's not going to work. The humble leader, no matter what happens in life, be good to people. I raise up my voice, not so I can shout, but that those without a voice can be heard. We cannot succeed when half of us are being held back. Humble leaders are very much about having small, cohesive teams. They're rule followers. They're humble and they're perceptive. They can feel when other people aren't following them and aren't able to kind of go along with what they had said. But they can be reluctant for change. When you need to make a change, they can kind of want to stay where they are. Oftentimes, they're hesitant and indirect, and so you don't always get a clear idea of where you're going, and they may not be good decision makers. Sometimes they don't prioritize in the way that things need to be prioritized. And when things need to move quickly, this is a more difficult type of leadership style. Lastly, we have the expert leaders. These are people who are truly experts in something. What do they say? They say, ignore the naysayers. Really, the only option is head down and to focus on the job. You need to get the balance right between action and reflection. With so many distractions, it is easy to forget to pause and take stock. These are people who are thinkers. They will have thought through the process from so many different directions that all of the details will actually be figured out before you even start. They're disciplined. They're not about things going all different directions. Things will be focused, they will be disciplined, and there will be expertise in the areas that they go into. Sometimes these people are cold and distant. The other problem with the expert leader is sometimes they often have to really think about things before they're willing to share. And so oftentimes they're not going to be the ones who speak up, even if they may have the best idea. They may not speak up at a leadership meeting right away or at a meeting right away because they're waiting to actually think through the entire process before they're willing to talk. Now, having all four of these types of leaders is really important. You can't just have one type of leader because we'd be very skewed in one direction. It's really important. You can love them, you can hate them, but all of these different leadership people are people who you may want on your team. These different leadership styles are things that you may want that will be helpful to you in thinking about things from multiple different directions. Importantly, we need to figure out what kind of leader we are. And so what I'm going to do is I'm going to actually have you take out your phone right now. And you're going to just go ahead and you're going to just take your phone. You're going to put it up to that, and it should bring you right up to the Slido, where you can put in your Slido what kind of leader you are. All right. And you should see the results right on your screen if you put your phone up. So we'll give you a minute or two to do that. I want to make sure you guys are still awake. And once you send your results, ooh, a lot of visionaries. Got a few experts. All right, we're going humble, experts, up, changing all over the place. Give it a minute. Humble tends to be leading this. Still moving. We'll give it another minute, another second or two. All right. So we have a predominance of humble leaders. About 25% are expert leaders. 18%, oh, we're still moving there. And visionaries and inspirational, about 16% there. Oh, vision just went up. And 10% don't know, which is very, very fair. And we're going to talk a little bit about that as well. There's personality testing that actually helps you figure out which personality best kind of suits you. Why is this important? Well, I tend to be a little bit of more of a dominant personality. I tend to be someone who's enthusiastic and outgoing and persuasive and kind of results determined. So if you look over here on this DISC personality, I'm kind of a DI up on the top. What happens is if I just go along in my DI world and I don't really think about how different people respond, then oftentimes I'm going to steamroll right over them and not give them the chance to contribute. And what that means, right, is that I'm not taking into account all the different pieces that I possibly can in making decisions. I can give you a good example of this is I used to have a nurse practitioner and we'd have a bad interaction with one of our patients. And I would, at the end of that, I would go to her and I would say, Mary, I would say, I feel like that didn't go so well. What could we do better? And all of a sudden she would back off because I would have just kind of confronted her with it right on the spot because that's my style. It's like, let's deal with it. Let's move on. Let's get it taken care of. And she was a very different personality style. And so she would back away and she would stop talking and it would end up in disaster. She'd be angry at me or frustrated with me. And I wasn't taking into account her personality style. What I learned by knowing more about my personality style was that instead I would say, hey, Mary, could we chat yet tomorrow about this patient? I really want to hear what your thoughts are about how this went wrong and how we could have done this better. And all of a sudden, she would come back to me with all these ideas of how we could have made that interaction better. And by doing that, I allowed her to use her personality style in a way that was helpful. Once you know more about your personality style, and there are lots and lots of different, these are just 3 different examples, you're more apt to helping people be able to share their opinion and get all the opinions you can so you can make the best decisions. This is particularly important in leadership. The other thing I want to talk about is that there are different styles that we use at different times. We don't always use the same style, and I'll give you a couple examples of that. So for instance, I might be delegative if I'm doing a laparoscopic appendectomy with a fellow and intern. Everything's going well. I have a fellow kind of leading it. I can kind of let them do things the way they want. They want to put the ports in a little bit differently. They want to go about it a little bit differently. They want to use clips. They want to use a ligature. Okay, it's all fine. I can do that, right? This is an area where there's lots of expertise. If you look on the bottom there, right? We have an expert subordinate. You have somebody, a fellow who really knows what they're doing. And you have a stable environment. Nothing really bad is happening. It's very easy. All of a sudden, my leadership style might change a little bit. If I have a stapler misfire with my fellow and it's happening at 10 a.m. and it's or 11 a.m. in the morning, it's the beginning of the day, I'm kind of a little bit more, I still have an expert, but now the environment is not quite so, we got to get things going, we got to get things doing. So I might let my fellow make suggestions, but I might say, I've seen that not work before. I'm not sure that that's going to work. It's going to be more participative. They're going to be able to interact in that session, but it's not going to be, do it however you want. That might work. That might work. It'll be okay because things are a little bit more in crisis at that time. Same thing is true if I have an intern doing an anal rectal case. They don't have really the expertise to necessarily know how to do that case. And so I might let them participate and say they want to do things a little bit, but I'm going to be a little bit more clear that this is the right way to do it, that we need to think about where that fistula is going to. This is how we're going to do it. I don't want you pushing through with a probe and making a new fistula track or anything like that. And if we get presacral bleeding at 8 p.m. on a pelvic descent, there's not going to be a lot of time for me to allow them to have opinions, right? We're doing this and this and this, and this is what I want done at this point. And I need, I'm going to be much more directive, much more authoritarian. So you can see that we actually use different leadership styles, and knowing that you have the space to use those different leadership styles at different times is also really helpful. The other thing to think about is that at different experiences, you have different powers of influence. And these are all different powers of influence. You're different at work than you are at home. You're different with some friends than you are with different ones. And again, a couple examples. So legitimate is your chair, right? Your chair actually is the person in charge, the person who actually gets to make decisions and do things like that. So they have legitimate power. They have a title, and that's their power from that. They can also have different types of power as well, but that is one type of power. The program director generally has both reward and coercive power. You did such a great job. Why don't you go down to the Ethicon course next week, because we have an extra spot and you've been doing such a great job. I'd like you to go. You didn't do all your paperwork. You haven't, put all your cases into the log. And so now you're not going to get to go to the operating room. Reward power, coercive power. Expert is the vascular surgeon who comes in after I've done and created a vascular injury. All of a sudden, I need this person's help, and they have the expertise. And referent is really the teacher of the year who always gets the case coverage because everyone loves working with them. They're just wonderful to work with. In different situations, you'll have different influence, and knowing how much influence you have in a situation as a leader or as a participant is also really helpful, because in those cases, you can use your power of influence differently. The other thing, as I mentioned before, is leaders need to work with others. So let's just kind of think about a team. I'm hoping most people still have a little bit of information. Remember Friends, the TV show? Do I see any nods or anything? The residents are like, not so much. Okay, some of us have. Well, Friends is a TV show, and these friends had very different personalities. So if, for instance, we needed to organize the OR schedule, we might choose a different friend than we would if we wanted to determine the best value for new OR lights. We want to distribute block time fairly, or we want to convince a donor to build a new OR. All of those different things are going to take different skills. We might need to do all of these jobs, but you can see you might not ask the same person to lead at all of those places. Oftentimes, when we have our go-to people and we ask them to do things all the time, even though their best skill set may not actually work with the skills we're asking them to do. Organize the OR schedule. Well, we want someone who's methodical, right? We want someone who's detail-oriented. We want someone, our visionary may not be the right person to organize in the OR schedule. The best value for the new lights, we want someone who's going to have logic, who's going to have details in terms of money and finances. Distributing block time fairly, we want someone who's very equitable, right? We don't want to have favorites and non-favorites. We want to have someone who's fair across the way. And convince a donor to build a new OR, we want someone who's really influential to be in that role and to make a difference in that space. The other way you can get to know yourself well is actually through strengths exercises. And this has become bigger all over the place. There's a relatively cheap one called Clifton Strengths, which is probably the best known one. And you can do this online for about $25. You can find out what your significant strengths are. And then there's actually a free one over on the right called Via Strength Finder. And by doing these things, you find out what are the strengths that you naturally come to. Ideally, these are the things that just come easy to yourself. Think about the way we evaluate each other, particularly, like if you're any sort of evaluation, you're always talked about what your weaknesses are and how you can improve your weaknesses. There's a little bit of a mind shift where people are thinking more about how to optimize your strengths and supplement your weaknesses either with other people, bring other people into your team, or to use your strengths to overcome your weaknesses in a way, rather than concentrating on, if I'm not good with numbers, you can give me numbers till I'm blue in the face, and I'm still not going to remember. I can't remember I can remember if the K is abnormal, but I'm not going to remember whether it was 2.4 or 2.6. That's just not in my skill set. So using your skill sets in ways that are most influential for you and most helpful to optimize. Sometimes it's changing a little bit of a job description. Sometimes it's not saying yes to projects that are not best in your skill set. By doing this, you can actually figure out what strengths you need outside of you in putting together a team, and also make sure that you're working in spaces that you're going to be the best you can, because they're really your strengths. The other thing I'll say about strengths is oftentimes they're things that you overlook because they come so easily to you that you forget that the rest of the world doesn't do it quite as well as you do. And that's actually the most interesting things about strengths, is that you forget that you actually have them. I want to also think about perspective. I think perspective is really important. And it's interesting because my 11-year-old daughter we're working on her learning about perspectives. And I was preparing this talk yesterday, and she looked at this and she goes, "What is this about?" And I said, "Well, the guy on the left says this is a 6, and the guy on the right says this is a 9. Which one of the people is correct?" And she goes, "Well, they're both correct because it's an opposite number." And I was like, "But they both think that they have the right answer." The idea is that if you step back and you actually think about things, not just from what you're seeing, but find what we call an alternative truth that somebody else is seeing, you are going to be so much more effective. And what's really easy is that we're just seeing our 6 because that's the direction we're coming from, and we're not seeing our 9. How do we do this better? How do we actually try to take into account somebody else's perspective? Well, one of my favorite ways to think about this is to actually think about Curious George. My daughter informs a lot of my talks, as you can see. Curious George is always curious, right? He's always trying to figure things out from some other direction. He's always thinking about things a little bit differently. And when I think about this, I think about asking a lot of questions. And I'm going to give you a little story to illustrate that. There's an old story of 2 chefs who are making a very fancy dinner for a very important person. And there's 1 orange left in the kitchen. 1 chef is in charge of dinner, and 1 chef is in charge of dessert. The chef in charge of dinner says, "I need the orange. Without the orange, I cannot finish my masterpiece, and we will have no dinner tonight." The chef for dessert says, "I need the orange. I cannot finish my dessert, and without that, the whole dinner will be a wash." And so after arguing and debating back and forth for quite a period of time, they decide the only fair thing to do is to cut the orange in half, and each of them will get the orange. And the chef who is making dinner stalks off with his half of an orange and squeezes the orange and says, "I do not have enough juice to make my dinner." And the chef with the other half, who is making dessert, marches off with his half of the orange and says, "I do not have enough peel to make my dessert." And obviously, as you can see, if they had actually just been curious and talked to each other, they would see that they both could have had the entire part of the orange that they wanted. The dinner chef could have had all the juice, and the dessert chef could have had all the peel, and they both could have been happy. And so they could have had that ultimate win-win situation. But because they didn't communicate well enough and look at it from each other's perspectives, they instead both ended up with suboptimal results. And so that's a little lesson just to make sure that you're being curious. And when somebody is saying no to you, you kind of think about it and think about the whys that they may be doing that, and ask them, what is it they're trying to get out of that situation? Leaders also need vision. I think that this is really, really important, that without figuring out where you want to go, you don't really get anywhere. Alice in Wonderland has a great quote from this, and this is Alice in Wonderland with a Cheshire cat. And Allison comes to a fork in the road, and she says, "Which road should I take?" And the Cheshire cat says, "Well, where do you want to go?" "I don't know," Alice answered. "Then," said the cat, "it doesn't really matter." As a leader, we need to have a vision of where we need to go. Otherwise, we just walk around in circles. And this is true in so many different ways. Your vision should be your vision. And first of all, you own it. You can change it whenever you want. People get worried about creating visions because they worry that it will not be adapted to whatever they want. It's your vision. You get to change it. But without knowing which way you want to go, you'll end up going nowhere or going in circles. Think about all these different pieces of medicine. There's finances of medicine, there's patient care, there's technology, there's microbiology. There's so many different ways to be envisioned, to have a vision and to decide where it is you want to go. And I think this is particularly true for the residents in terms of thinking where it is they want. But even when you get out, if you want to be a journal editor, spending more time reviewing papers and actually doing that is something that's going to be worthwhile. If your true goal is instead to create a new technology about how to do better surgery, maybe reviewing journal articles is fun for you, but maybe you want to spend your time instead doing something else. The other thing we often do is we often kind of keep our vision small and think about people who have the job we want or the role we want, instead of allowing ourselves to be super powerful and to think outside the box about something nobody's ever done before and nobody's ever put those combination together. Just because it doesn't exist does not mean it should not be your vision. You should give yourselves the ability to think about where it is you want to go. And I would say this particularly for junior people, residents, junior staff. Think about where it is, what it is you would like to achieve within the world of surgery, within your entire life, and then make it happen. Because if you don't actually give yourself the power to dream about it, the chances of it happening are very, very small. In my prior life, I used to teach ski lessons. And when we think about visioning down the slope, you have to look between the trees. Because if you look at the trees, you will literally ski into the trees. By creating that vision, by putting it up, by actually making it real and allowing yourself to think about it, you're able to make your way down through the trees and do that. How do we work from a vision down to actually making a difference? Well, we make goals. And those goals are just tiny little pieces in terms of how to get to that. Again, if you wanted to be an editor of a major journal, maybe your goal is to review a certain number of papers. Maybe your goal is to take a course. Maybe your goal is to network with people who are reviewers and can give you tips. There are lots of different ways. Each of those would be a goal that will get you towards that big vision. By putting together those little pieces, you can make this happen and actually get to that goal. The other thing I'll tell you about goals is that there's good data that by writing them down, they're much more powerful than just thinking them. By sharing them with someone, it's more powerful still. And if you share them with people, such as your mentors and people around societies that actually have the opportunity to actually make them happen, and you talk about them a whole lot, they're even more powerful. And you're even more likely to get where you want to go. So what I would tell you is that, and I'll go back to my 11-year-old daughter, I make her have goals every year, no matter what she wants to do. Create a vision, dream it big, allow it to be the vision of where you would like to go right now if anything in the world was possible. Then divide it down into steps, into goals, write it down, create those pieces, share your goals, and then review it. One of the things we type A type people end up doing is we jump over our successes. We run by them so quickly that we don't even take the time to celebrate them. I find by writing down my goals and looking at them about twice a year, I go back and I actually review and see where I am. I actually give myself the liberty to actually celebrate some of the things I've accomplished. And oftentimes we think about what we haven't done or what we still want to do, and we really don't celebrate those pieces. But I think that this is an important part in leadership. And in a team, it's also important to do this. So I want to spend the last bit talking a little bit about why we should train leaders. We all know that there are inequities in medicine. We all know that the playing field is not even for everybody. And there's been a lot of talk that goes beyond what I'm going to talk about today. But I think that if we're intentional about training leaders and making leaders out of everyone around us, that we will help to change some of those inequities. And I think it's about taking people one at a time. I think that's the best way to undo some inequities, is by making sure for every person that we touch, we're doing the best we can with them. I think we should standardize leadership development as an institution. That part of what we should do is actually create visions and goals. If you are mentoring residents, if you are mentoring junior faculty, this should be part of what you do on a regular basis. What are your goals? What are your visions? How are you doing at that? What could be little steps that you could take between this time and the next time we meet that could actually make a difference? I think we should also do personality testing. We should look at people's strengths and we should start working toward their strengths. Here are things that come really easy to you. How can we optimize that within our work environment? And how can we improve our communication and conflict skills? We can actually incorporate this into our annual reviews and evaluations of people. And I'll tell you, we started about a year and a half ago, we started a professional development program for our interns that does this. And particularly the personality testing has given them this new language so that when they're working in their teams, they actually can do a better job of actually saying, well, this is how this senior likes things. This attending wants things like this, but they have language to be able to talk about it that is now becoming ubiquitous throughout the residency. The other thing is, at least in ACGME, these actually meet some of the metrics that we're required to make. So for instance, vision and goal setting is something that actually comes up within our requirements. Additionally, conflict resolution and negotiation are things that our residents are evaluated on a regular basis. And we're spending a lot of time teaching them how to throw a knot or how to do a laparoscopic colectomy. And we're not spending the same time teaching them how to communicate. And if you think about the problem spots, whether that's in residence, whether that's in faculty, so much of this has to do with dynamics, interpersonal dynamics. And if we spend a tiny little bit of time spending time on this, thinking about their leadership style, thinking about their personality style, we could make a huge difference. In the ACGME requirements, there are actually 6 different places where just talking about these things would actually make a difference in what we evaluate our residents on. The other really cool thing about this is that if we think about and we know what our residents, our junior faculty's visions are, we can actually distribute opportunities more evenly. So for instance, if Intuitive has a robotic course, maybe the person who got, the extras because they did great research in microbiome doesn't get to go to the robots course. Maybe not everyone gets the same opportunities, but they all get opportunities. And we can take the things that are most important to individuals and make sure we're giving them those opportunities. We only do that if we ask, if we're curious. The other thing I really like, and this actually comes from Herb Chen, who's the chair down at University of Alabama, is one person, one job. Is the idea that at a certain point, it's time to pass things along. I actually passed off the program. I'm no longer a program director for our colorectal fellowship because I'd done enough of it. I'd spent enough time doing it, and it was time to pass it along to somebody else who I can mentor and help and make sure that they do a good job, they get new skills, and I move on to use my time doing something different. And I think that this is really important so that not one person doesn't get all the opportunities, but that we really share opportunities. The other thing we can do is we can really help lift each other up. By sharing opportunities, by knowing each other's goals, by figuring out where it is they want to go, we can help people. We can keep people accountable. Hey, you both celebrate their successes. You did a great job with that goal. And also going, hey, you haven't met this goal. How might we do better? How can I help you do that? And by lifting each other up, we'll actually all do better. The other thing we can do is give people room to lead. What we want to do is really make sure that we accommodate all of those different leadership styles, We give the experts time to think before they have to talk. We let them know what they need and give them tasks and leadership opportunities that give them the opportunity to be able to do what they need to do. Sometimes it's good to change things up. Just because you always lead in one direction, sometimes it's good to push your limits a little bit and change things and challenge yourself and try a different leadership style. But we can be thoughtful, again, intentional about doing that. And we can encourage, see where people are doing well, see where people aren't doing as well, and continue to support them. So I'm going to get to the end here. I want to go back again about what is leadership. So leadership is a process. It uses social influence. It maximizes the efforts of others towards the achievement of a vision. I think that this is really important. I think we all have leadership potential. I think we need to sometimes pull through some of the pieces around that to really see our leadership potential. I think it's important to know yourself. I think it's important to really look inside and see who you are and who you want to be, both with goals and also what kind of personality, what comes easy to you, what's harder for you, so that you can optimize. Because I think when we see what other people see in ourselves, we're going to be most effective at accomplishing whatever it is we want to accomplish. With that, I want to say thank you very much for the honor of being here today. And I hope that I've at least made you think a little bit differently about leadership.
Thank you very, very much, Dr. Stein. That was really inspiring and definitely provoking to introspect and to take the time to think I mean, I don't know exactly what my leadership style is, and I think that's very, very helpful. Any questions from the audience? Dr. Feldman.
Thank you very much, Dr. Stein. That was a great talk. I'm sure they're leaving many people with things to think about. What do you think is the role of, we've seen leading centers, and we've tried to emulate that a bit of creating our own leadership development program in the department. Also, I'm sure you and lots of people here have participated in other, whether that's through executive MBA type of stuff, or their own exploration or their own courses. I mean, and I'm sort of conflicted about the benefit of it. On one side, I think it's an opportunity really to just carve out time to think about these things. It's probably one of the greatest benefits. So what's your take on, some of those programs?
Yeah, I think it's a great question, actually. And Kevin said, how are your residents taught these skills? I think kind of combine them both. I think the major problem with a lot of leadership development is the lack of longitudinal, there's no longitudinal program. So if you go somewhere and you spend 3 days doing great talks, hearing great things, even thinking about things, I think as soon as you go back, it's really easy to slide back where you are. And I think if we want to make leadership, people more conscious of their own leadership styles, what they do, all of that type of thing, I think what we need is longitudinal guidance. And there are a couple ways to do that. First of all, they need to be interactive. I think that lecturing someone, I mean, this talk is kind of thought-provoking, but it's not going to make you change what you do in 90% of the, 99% of the time, right? We know that from all of the courses we go to and everything. How is this going to change your practice? Well, if we went back in a year, how did it actually change your practice? Probably not so much. So what we need to do is interactive. What in the first part, and I'll talk a little bit about the details. Then what I think people need is they need to be accountable, whether it's a mentor, whether it's a peer group that can then make them accountable, or, I think coaching is also really good so that people are accountable for saying, what did you implement? How did you change that? How did you use your skills? And kind of revisit things again and again. And I think without that, we don't change habits. We know that about habits, right? There's enough data on how you change what you do. In terms of kind of the content, what I think is really important is it needs to be a little bit of introspection. What we do for our intern program, and I just do this, we do a really easy personality test called the Peace Palette. which is literally 4 different personalities. It's red, yellow, blue, green, and it's really easy to get a language. It takes about 10 minutes, which we do in the session. It's not a whole huge expensive test. And we do it in a session. And then we do a couple skill sets to kind of like talk about what those are. And then they go out, and about a month later, or a month and a half later, they come back and they do a communications workshop, again, looking at those colors. And we allows them to kind of, again, be accountable and come back. And then we do a negotiations workshop. And last year we did a diversity workshop. But what we're doing is we're building on the same skills, using the same language again and again, so that it becomes ingrained. And when they see someone that they're having trouble with now, what I've seen a number of the interns do is they kind of go, oh, I'm having trouble with Dr. So-and-so. Okay, what personality style do I think he has? Well, maybe I can't figure it out, but maybe I can ask a friend who's also worked with him to say, okay, this is that personality style. Am I giving him information in a way that is most suitable for that personality style? Does he want a quick one-liner? Is he a detail-oriented person who needs all of this? Does he need me to play by rules, or is it all about the people? Like, which of those 4 major areas are we doing? I think when we do things like that, we actually can change the needle, and we can actually make people better at conflict. And again, I'm sure you spend a lot of time talking to people about interpersonal things. And if they have a little more insight, maybe we could decrease the number of times that we're doing that. I think those types of things, which are really interactive, where you're hammering the same skills again and again, you're holding people accountable. Those are the types of things where we can hopefully find that people do a better job over time.
Great, thank you.
Thank you very much. Well, with that, hopefully this is a conversation that we keep going within our departments and with you at large. Lots of terrific talk, and thank you very much in the chat. We really appreciate your insights, your expertise, and the time you spent with us this morning. Thank you very much, Sharon.
Thanks so much for having me. Have a great day, everybody.
Have a great day, everybody.
Thanks, Sharon. Thank you very much. Bye.
Bye.
Thanks, Mary Lise.
Thank you, Leanne.
Bye.
Bye.